everyone, and today the topic is adrenal medulla, one of the important glands of the body. Apart from adrenal medulla, we see the other topics that are being covered today are the entire adrenal medulla, local hormones, and pineal gland. Now, we see clearly what exactly the adrenal medulla is, including its synthesis, its regulation, and what is called its the physiological actions applied aspects with other two hormones, local hormones and pineal glands. Here is the adrenal medulla. The adrenal gland is located over the kidney like a cap over the kidney on both the kidneys. It has two regions, adrenal cortex and adrenal medulla. Two regions are there. And inside, it is composed of groups of cells called chromaffin cells or pheochromocytes. These cells contain fine granules which secrete or release adrenaline, noradrenaline, and dopamine. The other names of adrenaline, noradrenaline, and dopamine are epinephrine and norepinephrine. The adrenaline and noradrenaline are called catecholamines. We call the hormones that are mainly secreted from the medulla are known as catecholamines. Coming to the biosynthesis of the hormone, it is synthesized from a amino acid called tyrosine. So the L-tyrosine is converted into levodopa by the enzyme known as thyroxine hydroxylase. Once levodopa converted into dopamine with another enzyme called dopa decarboxylase. Dopamine is converted into noradrenaline with another enzyme known as dopamine beta oxidase. The noradrenaline is converted into adrenaline, another medullary hormone, in the presence of N-methyl transferase enzyme. This is what the biosynthesis of the hormones from the adrenal medulla. Now we'll be talking about the receptors of the gland. There are two receptors are there, namely called alpha and beta. Alpha again divided into alpha 1 and alpha 2, and a beta is divided into beta 1 and beta 2. The noradrenaline has got higher affinity towards the alpha receptors, whereas you know uh, whereas your this one whereas adrenaline has the affinity towards alpha and beta, both receptors. Alpha again divided into alpha 1 and alpha 2. Already I mentioned beta is divided into beta 1 and beta 2 receptors. Say for example, noradrenaline combines with alpha receptors on arteriolar smooth muscles, which causes vasoconstriction in them. Beta receptors are present on bronchial smooth muscles, causes bronchodilation in the respiratory system. These are about receptors, very, very important. Now the physiological actions, mainly over the CVS. CVS includes heart rate, cardiac output, BP, and total peripheral resistance. In heart rate, adrenaline acts directly on the heart through beta 1 receptors, increases heart rate and force of contraction. Noradrenaline decreases the and producing the bradycardia due to reflex mechanism. The name of the reflex is called Mary's reflex. It's very important for the examination point of view. Mary's reflex says heart rate is always indirectly proportional to BP. That means heart rate is increases and BP automatically decreases. Then cardiac output. Adrenaline increases heart rate and stroke volume, resulting in higher cardiac output, and noradrenaline declines it. Over the BP is another parameter. In the BP, we can talk adrenaline increases systolic BP due to increase in cardiac output and decrease in diastolic BP. Norepinephrine increases both systolic and diastolic BP, thereby it increases total peripheral resistance. After the BP, after the BP, we can say after the BP, total peripheral resistance, adrenaline produce vasodilatation in skeletal muscle and liver and vasoconstriction elsewhere of the body, so it decreases total peripheral resistance. However, noradrenaline produce vasoconstriction in most organs of the body. That means which increasing the total peripheral resistance. We can also see the action, these were the actions over the what do you call the heart, overall activity of the heart is the effect of adrenaline and noradrenaline. Actions on smooth muscle, it produces, epinephrine produces, particularly on the eye, causes dilation of the pupil. In the GIT, releases relaxes general musculature and contraction of the sphincters of the gallbladder and spleen. Over the bladder, it relaxes the detrusor muscle and causes contraction of internal sphincter. Contraction of the internal sphincter. On the ureter, epinephrine inhibits ureter uterine muscle a contraction during the late during the you- during the late pregnancy, whereas noradrenaline stimulates the contraction of the gland. This is over action over the adrenaline action over what do you call over the epinephrine action over the smooth muscle. And bronchial smooth muscle also epinephrine relaxes the bronchiolar smooth muscles. Norepinephrine, norepinephrine is very less effective action. It's less effective over the bronchial smooth muscle. Now, the important actions are for the metabolism, particularly carbohydrate metabolism. In the carbohydrate metabolism, epinephrine increases blood sugar level by glycogenolysis in liver and the muscles, inhibits the secretion and stimulates the glucagon secretion, increases the hepatic production of glucose from lactate, and finally it stimulates calorie genesis. Number one, glycogenolysis in the liver and muscle, increasing the blood sugar level, inhibit secretion and stimulates the glucagon secretion, secretion of insulin. I'm sorry, here I forgot. Insulin secretion is inhibited, whereas stimulates glucagon secretion. Increases hepatic production of glucose from the lactate, glycerol, amino acids. We call it as gluconeogenesis. And finally, the one point like to add it is stimulates calorie genesis. Calorie genesis. The blood lactate already I mentioned about it, increasing the hepatic production of glucose from the lactate, blood lactate level increases, and calorie genesis is also mentioned. Next, over the lipid metabolism, epinephrine mobilizes free fatty acids in the blood, so increases free fatty acid level in the blood. It activates hormones like lipase and causes lipolysis. Action on the skeletal muscle, epinephrine increasing the muscle blood flow. It increases force of the contraction both in the normal and fatigued muscle. The overall intracellular and extracellular calcium level is maintained by the catecholamines. Catecholamines increases RBC and hemoglobin level because they will be diverted, shifting them in the from the stored area to the circulating area. WBC count increases due to shifting of marginated pool to the circulated pool is also occur due to the catecholamines. On the CNS, they stimulate the CNS, causing increasing anxiety, increasing excitability, causes tremor, and it activates RAS, reticular activating system, and thereby causing arousal of the individual. Over the hormones, catecholamines inhibit the secretion of the hormones like insulin and stimulate the secretion of the glucagon. This is the effect over the hormones. Now, regulation of secretion of the medullary hormones. First, we'll be talking about resting secretion. Even a person or animal is in a resting condition, catecholamines are secreted under resting condition called resting secretion. Some of the secretion during stress also occurs. Examples: physical exertion, exposure to cold, fall in BP, hypoglycemia. These are the conditions. And its role during stress and emotions also, the hormone is secreted in both the conditions, like from the adrenal medulla, the hormones are secreted during stress and emotion. Even sympathetic nervous system is stimulated and bring all various changes, bodily changes, metabolic changes occur to control or to affect meet the effects of this stress. That is why these hormones are very important. They play an important role in the fight reaction flight or fight reaction. The disorders of medulla, we call it as a condition called pheochromocytoma. The meaning is a tumor of the medulla sometimes excretes large amounts of, not sometimes, excreting large amount of the catecholamines. The clinical symptom is hypertension. The only treatment is a removal of the tumor. We do a test for it is called histamine test, and in the histamine test is given to normal subjects or hypertensive subjects. There will be slight fall in BP in them if the histamine is given. A patient with pheochromocytoma, there will be marked rise in systolic diastolic BP, which can be reduced by a substance, a regitine called epinephrine antagonist, is the indication for us that he is suffering from, and a condition called pheochromocytoma. The second gland is called pineal gland. In olden days, it is said to be in the like a center of both eyebrows where this gland is located exactly. Superior colliculi, roof of the third ventricle at the posterior aspect end of corpus callosum, located at the place of the third eye, weighing 120 milligram with a rich blood supply, and consists of two types of the cells: parenchymal cells or pinealocytes or neuroglia. We all know neuroglia are the supporting cells supplied by postganglionic sympathetic nerve fibers from cells in superior cervical ganglion, and it is secreting hormone like melatonin, which is synthesized from 5-HT, is a serotonin, and norepinephrine is also, both are synthesized by pinealocytes. Like the medulla, adrenal medulla, posterior pituitary gland secreting oxytocin and ADH, JG cells, juxtaglomerular cells of the kidney, and even this gland is too secreting melatonin in response to sympathetic activity. Pineal gland is large in infants because as the age advances, it grows in size. The size, sorry, decreases, gradually decreases, and calcifies during the decades of the life, but continues to secrete melatonin. In adults, displacement of the calcified pineal gland from its normal position is indicating the presence of a space occupying lesion we call brain tumor. You can suspect brain tumor by the formation of that particular space. Its concentration in human varies from 40 to 400 micrograms, its secretion being highly lipid soluble, which is penetrating into the hypothalamus to midbrain peripheral nerve fibers, CSF, and gonads. Melatonin plasma concentration is higher in children than adults, and in blood declines with age. As the age is advancing, its concentration declines with the age, but in children, it is abundantly, its level is available in the blood. The secretion of melatonin, the secretion of the melatonin is regulated or controlled by it is synthesized and secreted, its secretion or increased during the dark period of the day, and it is low during the light period of the day. You have to remember it. Its secretion is more in dark period of the day, and its secretion is low in the lighter period of the day. Coming to the functions of the melatonin performs so many actions. Contracts melanophores in amphibians skin and thus lightens its color, regulates onset of puberty, the pineal gland secreting gonadotrophic inhibiting peptide, which inhibit the secretion of hypothalamic gonadotrophic releasing hormone, which decreases the secretion of FSH and LH from anterior pituitary, which may delay the onset of the puberty in individuals. It inhibits the secretion of thyroid and adrenal cortical hormone. It is helpful for maintaining the sleep wakeful cycle, helps to maintain the biological rhythms of the body. So many actions are executed by it. Contracts the melanophores in amphibian, regulate onset of the puberty, inhibit the secretion of thyroid adrenal cortical hormone, helps to maintain sleep wakeful cycle, and maintain the biological rhythm of the day. Biological clock of the individual is also maintained. Controlling of melatonin secretion is done by when a person is exposed to darkness, it stimulates secretion of melatonin, whereas exposure to the light inhibits its secretion. This is how the melatonin is controlled. When you focus the pathway of melatonin, it starts from retina through the retina, then from the optic nerve, optic tract, brain stem, from there to superior cervical ganglion, sympathetic noradrenergic pathway, to the pineal gland, which increases in cellular cyclic AMP that secreting the melatonin. This is the pathway how it is secreted. Now the third part of the class is, with this we can wind up, the local hormones. These are the hormones act on the same area or the neighborhood, synthesized mainly in the tissues and blood, which are produced in the tissues are called prostaglandins and other related substances like heparin, leptin, and GIT hormones. The others are acetylcholine, serotonin, and histamine. Hormones which are synthesized from blood are serotonin, angiotensin, and kinin, which comes under the hormones, other category hormones, other synthesized in the tissues and blood, I said, and these are other related substances, particularly which are from the blood are serotonin, angiotensin, and kinin. Prostaglandins and related substances, thromboxanes, prostacyclin, leukotrienes, and lipoxins. Prostaglandins, all the local hormones derived from arachianide, any hormone you talk about, they are derived from arachidonic acid. These are particularly the prostaglandins are isolated from human semen. The types are prostaglandin A2, D2, E2, and F2. The actions on the blood, the prostaglandins accelerate the capacity of the RBCs to pass through minute vessels. By a process called diapedesis. On blood vessels, particularly PGE2 causes vasodilatation and RH bronchodilation. Lipids inhibit the release of free fatty acid from adipose tissue. CNS control the activity of neurotransmitter release. Kidney stimulate juxtaglomerular apparatus and increases secretion of renin. And another one is called thromboxane A2. Where is the thromboxane A2 come from? This was thromboxane, other substances, prostaglandins and related substances are thromboxanes. The thromboxane, after all the actions, they are secreted from platelets, granules of the platelets. Thromboxane A2 is formed from B2, is a metabolite of B2, causes vasoconstriction and play a role in hemostasis by accelerating the aggregation of the platelets. Prostacyclin is produced in endothelial cells and smooth muscle cells of the blood vessels. They cause vasodilation and inhibits platelet aggregation, all platelets coming together for the sealing the wound is the aggregation. Lipoxins are of two types, A and B. A causes dilation of minute vessels, B inhibits cytotoxic effects of killer T cells. Leukotrienes, mediates of all allergic reactions, promote inflammatory responses. Now the second category is the hormones that are formed from the blood are bradykinin and kallidin. Their action dilate blood vessels and decreases the BP, vasodilator action which increases blood flow, increases permeability of capillaries during inflammation causes edema, stimulates pain receptors, causes contraction of smooth muscles of intestine. These were the actions of hormones that are produced from bradykinin and calidin. The action of the calidin is a potent or powerful vasodilator. So with this, we have completed the topic. Thank you. Thanks for patient listening. If you have any doubts in the topic, please and come and ask me personally so I can clarify your doubts.